What is liver cirrhosis? It is a end stage liver disease. Okay. Now let us learn about normal liver. Okay. Normal liver's hepatic lobule, it consists of portal tract and a central vein. Consists of a portal tract and a central vein. And this portal tract, it consists of a one bile duct, portal vein and hepatic artery. Between this central vein and the portal tract, you'll be seeing hepatocytes. Okay. Suppose if you take this part, these are hepatocytes, and this is between the hepatocytes there is a sinusoid. Okay, this sinusoid. These sinusoids are lined by endothelial cells. Okay, these endothelial cells are kinds of Kupffer cells. And next, between these hepatocytes and sinusoids there is a space. Okay, you can see this space. This is nothing but space of descent. Okay, this space consists of some cells. These are known as Ito cells. Okay, now so what's the main function of these Ito cells? They mainly cause fibrosis in cirrhosis. At the microscopy, you'll be seeing a central vein and a portal tract which consists of bile duct, portal vein and hepatic artery. And these are hepatocytes. Okay, and next between these hepatocytes there are sinusoids. Okay, and now if you look at each hepatocyte cell, these are polygonal cells with central nucleus. This is a single hepatocyte. Now if you are coming to the zones, okay, there are how many zones? 3 zones. Okay, and always remember, this is zone 1, this is zone number 2, this is zone 2. Now coming to the cirrhosis of liver, it is a end stage liver disease. Okay, it is mainly characterized by, okay, you have to remember 3 things. Okay, number 1 is it consists of, there is disruption of normal architecture, and second is you will see regenerating nodules. Okay, and third one will be seeing mainly bridging fibrous septa. In this picture you will be seeing about all the 3 features. Okay, that is loss of normal architecture, and you are seeing regenerating nodules, and these nodules are separated by fibrous septa. Classification of cirrhosis is done based on 2 things. Okay, one is morphological classification and second is etiological. Okay, this morphological is done mainly based on size of nodules. In morphological classification, it is of 3 types. Okay, if the size of nodules is less than 3 mm, if it is greater than 3 mm, if it is less than 3 mm, it is known as microscopic. nodular cirrhosis. It is greater in term is known as macronodular cirrhosis. Suppose that cirrhotic liver consists of both micro and macro, that is known as mixed nodular cirrhosis. Coming to the etiological classification, the most common is alcoholic cirrhosis, which is 60 to 70%. Loss, we see bigger nodules. In case of micro, these are less than 3 mm. And next if we consider the causes, in micronodular it is mainly due to early alcoholic liver disease. In case of macronodular it is late ELD. It may be due to hemochromatosis. In case of macro, Wilson's disease. And macronodular because of viral hepatitis. It may be because of alpha-1 antitrypsin deficiency or due to toxicity of the drugs. Primary biliary cirrhosis and Indian childhood cirrhosis. Now see here, type 1 and type 3 collagen are mainly present in the zone 1 and zone 3. Okay, and type 2 collagen is present in the space of this. Okay, what happens in cirrhosis? In cirrhosis, you will be seeing type 1 and type 3 collagen in space of this. Because of accumulation of type 1 and type 3 collagen, it leads to loss of fenestration of sinusoids. This leads to capillarization of sinusoids. Okay, pathogenesis of liver cirrhosis. Okay, if you consider this under two headings like hepatic injury, or when there is there is intake of chronic alcoholism, or when there is increased levels of cytokines, chemokines, and when there is oxidative stress. Okay, when due to this, these mainly they activate the stellate cells. Stellate cells are also known as Ito cells. When stellate cells are activated, it lead to fibrosis. Okay, coming under this one, hepatic injury. Whenever there is injury to the liver, there is death of liver cell with loss of architecture. Okay, the normal architecture of the liver is lost. Okay, this leads to both this one and this, they will stimulate the, okay, whenever the liver cells are damaged, there are still remaining some of the surviving hepatocytes are present. These surviving hepatocytes, they will start regenerating and proliferating. Because of this, there is formation of regenerating nodules. Okay, this is the coming to the clinical presentation. You will see the most common features of anorexia, weight loss, and weakness. Okay, and clinical presentation you can be classified in based on two effects. Okay, one is effects of portal hypertension. Okay, one is effects of portal hypertension, and one more is it is because of liver cells failure. Okay, one is effects of portal hypertension and one more is due to effects of liver cells failure. Effects of portal hypertension, you will see esophageal varices, splenomegaly, ascites, caput matrix, rectal varicose. Ascites is the important one. And when you come to this, like, if you want to know what is caput medusa means nothing but there is dilation of abdominal veins. That is dilation of abdominal veins. Due to effects of liver cells failure, it may lead to coma, spiral nevi, gynecomastia, jaundice, ascites, testicular atrophy, anemia, ankle edema, liver flap. Now here ascites is mainly due to decreased albumin synthesis. Okay, so it is very important while answering a 10-mark question. Okay, whenever the 10-mark question is based on the case presentation, they will be having all these symptoms and the history of chronic alcoholism. Remember this. The diagnosis is alcoholic cirrhosis. Morphological features, which is the most important part in terms of pathology. Okay, first let us know about the macroscopic view. Okay, macroscopic view, let us learn in two terms. One is early stage and late stage of cirrhosis. In case of early stage, okay, I will be comparing both of them. In case of early stage, it will be liver appears yellow tan. Okay, and in case of late stage, it appears brown. Okay, and next, in case of early stage, you'll be seeing a fatty liver. Okay, but here it is non-fatty. Here the liver is enlarged. Okay, it is enlarged such that it may weigh sometimes greater than 2 kg. But in case of late stage, it is shrunken. Okay, completely shrunken, and it may weigh less than 1 kg. Okay. Microscopic features of cirrhosis. In this, mainly there is first one is this loss of architecture. Okay, yes, the normal hepatic lobule architecture is lost. Okay, and you will be seeing what you will be seeing regenerating nodules. Okay, these regenerating nodules, hepatocytes, they are arranged in the form of nodules. Okay, okay, and in these regenerating nodules, in some of the hepatocytes, you may see some fatty chains. Okay, and how does these hepatocytes look? They are round with central nucleus, and some of them you will be seeing some fatty chains. Let's come into the next part. Important feature you will be seeing is fibrosis. Okay, you are seeing a fibrosis. This fibrosis, fibrous septa, is separate two nodules. Okay, and the fourth one is you will see proliferation of bile duct. Okay, you will see so many bile ducts. Okay, and fifth feature is you will be seeing vascular reorganization. Okay, and the last important thing is in fibrosis, you may see sometimes there may be some inflammation also. There may be some inflammation. There will be some inflammation and necrosis also.